Hello everyone. Everyone always asks me, especially when they're starting care, how long is this health problem gonna take to feel better? Well, sometimes these things can feel better really quickly, but there's really three types of care in our office. When we look at this chart, it really lines it out. When we start out, we're seeing the person a little bit more frequently. The patient is in pain. The patient has inflammation. As we work on them, we're working, our first goal is to get the patient feeling better. Get them feeling better as quickly as I can. To do that, I use the adjustments. I'll do soft tissue work with the master massager or other tools that we have. We can also use kinesio tape a lot in this phase. But our goal is to get you right to the end of this red where you're feeling better, your symptoms are mostly gone, or maybe it comes and goes. Now the next phase we have is, it's yellow here, but it's where really soft tissue reconstruction is occurring. So right here we got you out of pain, but this is a very weak spine still. If you were to quit care right here when your symptoms are gone without considering how to get it, further improvement, you could fall backwards into pain again. So for full healing and recovery, we recommend a reduced frequency. We see the frequency dropping here. We're not seeing you quite as often, maybe once a week at this point, where you're feeling great, but your soft tissues are rebuilding. That's your ligaments, your tendons, your muscles. Things are starting to get stronger. As we move out of that into the green, you can see visit frequency getting much less. We're moving into just into the strengthening and stabilization phase. That's the third phase. At this point, maybe we're seeing you once every other week, maybe we're seeing you once a month, but you're very healthy overall. We're working in the prevention department. We're preventing this thing. Spinal stabilization has occurred. Optimum function is occurring. You've been doing your at-home exercises like the ones you've seen on some of our other videos. Your chances of returning to the same old injury very low. That one's long gone. Now, does that mean you can never have pain again in your spine? Absolutely not. We all do crazy things. We fall off ladders. We pull weeds too hard, and we get new problems, which may push us back, or we may have a whole new problem. Depending on severity, we have to work back up this scale again. If it's a real difficult health problem like a car accident, this can take up to a year. In some cases, it only takes 4 to 6 to 8 weeks, something like that, to really get you feeling better, even from some long-standing chronic type health problems. So anyway, just wanted to explain the three types of care here in our office, so that you understood that when the pain's gone, the problem's not necessarily totally fixed. I'm Dr. Owens. Have a great night.